Hello, welcome to Salina Regional's Morning Medical. My name is Mike Maddock from the Marketing Department at Salina Regional Health Center. Thanks for joining us today. This morning I have Dr. Kevin Norris. Dr. Norris is the Medical Director of Hospice of Salina. I understand 20 years of that, so thank you very much for being on the show. I know I've not had any personal dealing with hospice, but the one thing I've heard over and over from everybody is, you know, at what should be a horrible time in their life, somehow a rewarding experience came out of it. So you guys are doing some things right. Why don't you tell us a little bit about it?
Yeah, well, Hospice of Salina in one form or another has been here for 35 years, and I've been the medical director for 20. Over that time, we've had the good fortune of working with a lot of very dedicated staff. Hospice 20 years ago wasn't in the forefront of most people's minds in those situations, and certainly most practitioners' minds. So with hospice, we take an approach where we kind of back away from all the technology and all the new possible treatments that have a very low chance of success, and we focus more on the patient and the family, trying to preserve dignity, which can get lost in a ICU setting. We do this with a team of people. We have a team approach. There's a medical director, nurse, pastoral care, social work, and then a team of volunteers that are available to help as well. We can solve a lot of problems at the end of life, from helping the family through a difficult situation to getting paperwork done, all the things that pop up in those situations that people don't think about because they've been dealing with a loved one's disease process for so long.
I know you talked about, you know, it is different than it was 20 years ago, and I think one thing as well is looking at the whole disease process and maybe bringing hospice in a little bit earlier, even before, you know, necessary, but at least that they're in part of the conversation.
It's oftentimes not the first thing you think about. You're thinking about treatment, and you know. But there's a point where it should become fairly obvious that, you know, I think we need to be having a different discussion here with this patient and their family.
Okay, thank you very much. Thank you so much. Thank you for your staff. Thank you for watching. For more information, please go to srhc.com and like us on Facebook for the latest news and updates.